Hello everybody, today I would like to talk about sciatica. A lot of people suffer from this condition, so I'm going to explain the causes of sciatica and show you some exercises that can help to get instant relief. Sciatica is a pain that travels along the sciatic nerve. The sciatic nerve is the longest and largest nerve inside the body. It has 5 nerve roots from the lower back and sacrum, and it travels down the hips, thighs, and all the way down to the foot. Sciatic pain is often a burning, sharp, or radiating type of pain, and it happens because the sciatic nerves are pinched. Besides the pain, people who suffer from sciatica could also experience a numbness and weakness from the lower back down the legs. There could be many reasons why sciatica happens, such as number 1, herniated disc. In between our vertebrae, we have discs which are used as a cushion so that it can absorb shock while we do movements like running or jumping. Our discs are like a jelly donut in that the outer layer is firmer and the inner layer is soft and jelly-like. Due to the acute injuries or chronic poor posture, it could lead to the crack of the outer layer of the disc. So the jelly-like inner substance leaks out and touches the sciatic nerve, creating the pain. Number 2, degenerative disc. They are the natural wear down of the disc. The wearing down of the disc shortens their height and leads to nerve passageways becoming narrower. This can pinch the sciatic nerve and causes pain. Number 3, spinal stenosis. Spinal canal is a hollow passage in the vertebrae through which the spinal cord runs. In spinal stenosis, there is a narrowing of the spinal canal that puts pressure on the sciatic nerve. Number 4, spondylolisthesis. This is a condition in which a vertebral body slips out of place and presses on the sciatic nerve. Number 5, bone spur. Bone spurs are bony growths that form over a period of time, usually due to normal wear and tear of the bones. The spurs themselves are not painful, but if they grow near the nerves and it pinches them, it can cause pain. Number 6, piriformis syndrome. Sometimes there are no issues with the lower back and spine. It could be related to a muscle called piriformis in the buttock region. If the piriformis is too tight or it has spasms, it could irritate the sciatic nerve and lead to sciatica. And number 7, others. There are other reasons that sciatica could happen, such as tumors or infections in the area. The 2 most common reasons for sciatic pain is a herniated disc or piriformis syndrome. So now I would like to show you some tests that can differentiate these 2. Of course, it is always best to go to a professional to make the most accurate diagnosis. Imaging tests such as X-ray, MRI, and CT combined with other physical examinations and understanding your medical history is the best in accurately finding the cause for sciatica, thus finding the best solution for that. But for home, you can do the below simple tests. Let's test for a herniated disc. We're going to do what is called a slump test. You can first sit upright, put your hands behind your back, and now round your back and slump, then followed by a neck flexion. Now we first extend our knee on the good side, then flex our foot, and then we do the same on the affected side. A positive slump test is one where you experience pain, numbness, or tingling in the buttocks and down the back of the leg when the test is performed. This might indicate sciatica due to disc herniation. There are limitations to this test that it might not be 100% accurate, but it is very easy to perform that we can all do at home. Now let's test for piriformis syndrome. First, we can just press the piriformis muscle. If we feel there is a significant more soreness on the affected side, then we might have piriformis syndrome. Another easy test we can do is to lift the legs up in this position and then roll our foot out. This motion stretches the piriformis muscle. We can do this in front of the mirror or ask someone else to check to see if there's a big difference. If it is way less mobile on the affected side, then you might have piriformis syndrome. Now I would like to share with you 2 sets of exercises that can help to relieve sciatica due to the most common 2 causes as mentioned, a herniated disc and piriformis syndrome. Let's first talk about herniated disc. We can first lie down and hug our knees with both our knees touching each other and then both our ankles touching each other. And we can do a rock and shaking motion. We should be able to feel an opening sensation of the lower back. And we can do this for 20 times. For For the next movement, we can put the hands on the side and then do a left and right stretch. It is better to do this slowly and gently, and we can do 20 times on each side, and you should feel really relaxed on the lower back afterwards. The last movement is simply just put a pillow underneath your lower back, and then we can just rest for 15 minutes. Now I would like to share with you some exercises for Piriformis syndrome. For the first Piriformis stretch, we just lift our knees up and then we're going to pull that towards our opposite shoulder, and we can hold this for about 1 minute. And then for this one, we have to do both sides. So we have to do both sides 1 minute each, and then we can do a total of 3 sets. Now we're going to do a figure 4 stretch. We're going to take the affected side and cross it over on top of the thigh of the good side and lean forward while we're keeping our back straight. You should feel that your piriformis muscle is stretching. Hold this for 30 to 45 seconds, and then we can do 3 to 5 sets. I hope the above exercises can be helpful to you. By stretching, stabilizing, and strengthening the right muscles, you can reduce stress on the sciatic nerve and achieve lasting relief. Sciatica can be a debilitating condition, but with the right exercises and treatments, it is possible to relieve or even cure the symptoms. So don't let sciatica control your life. Take control of your sciatica with these effective exercises and techniques. Thank you for watching today. If you have any questions, leave in the comment section below. Stay healthy, and I will see you next time.